Good afternoon and hello. My name is Renee D. Waring and I am the founder of Uniquely and Wonderfully Made Ministries. The title of my presentation today is Mental Hospitals Mental Illness Part 4 R period WARRING. My presentations can be viewed on LinkedIn under Renee D. Waring, on Facebook under Waring Communications LLC, on Twitter under @Renee Waring, and on YouTube under WARRING. In my last presentation, we learned that in the 1890s, psychiatric hospitals were being criticized because they were overcrowded and therefore they were giving patients some standard care. In addition, states were not able to provide financial resources to give patients acceptable care. Superintendents made an effort to provide moral treatment to their patients by establishing nurse training schools. Instead of following the European treatment model, in which nursing students of psychiatric hospitals were given a different credentialing exam from those given to nursing students in the general hospitals, the superintendents wanted to administer a psychiatric nurse students the same exam that general hospital nursing students were given. The American Nurses Association fought to prevent this from happening, but they were unsuccessful in their efforts. In the 1930s, the state appropriations for psychiatric hospitals were cut drastically. Then America entered World War II. The staffs of psychiatric hospitals were also cut. Psychiatrists began looking for alternative ways of treating people who had mental illness. They looked for ways to break psychiatric treatment into smaller parts. In other words, they established alternatives to psychiatric hospitalization. The psychiatrists put people with acute mental illness in general hospitals. Other psychiatrists turned to the early 20th century's mental hygiene movement by creating outpatient clinics and new forms of private practices focused on actively preventing the disorders that might lead to psychiatric hospitalization. Still, others experimented with forms of therapies that pose brain pathology as the cause of mental illness. They tried insulin and electroshock therapies, psychosurgery, and different kinds of medications. The new medication, chlorpheniramine, was given to patients who had the most persistent and severe psychiatric conditions, with hope that they would be cured. A new system of nursing homes would meet the needs of vulnerable elders. Therefore, the numbers of people in psychiatric hospitals went down dramatically. A new system of mental health was created. It was called Community Mental Health System, which would return people who had mental illness to their families and to their communities. Today, only a small number of historic public and private psychiatric hospitals exist. There is a whole web of services provided for people who have mental illness. There are crisis services provided for people who have mental illness, hospital-based acute psychiatric care units, outpatient services ranging from the 24-hour assisted living environments to clinics, clinicians' offices offering a range of psychopharmaceutical and psychotherapeutic treatments. The availability of these outpatient services varies widely, which leads some historians and policy experts to wonder if asylums may be needed for the most vulnerable individuals who need supportive living environments. Thus ends my presentation for today. My next video can be viewed on the following social media sites: on LinkedIn under Renee D. Waring, on Facebook under Waring Communications LLC, on Twitter under @Renee Waring, and on YouTube under smallcase Warring. I am the founder of Uniquely and Wonderfully Made Ministries. My name is Renee D. Waring, and I am the Warrior Warring.